This is part two. Talked about panic attacks as being subliminal flashbacks, flashback to a terrifying event, but you have no visuals of it, you just feel the feelings from it. You misunderstand what the feelings are from, you think you're having a heart attack and you panic. Who wouldn't? And we say that, well, why don't you recognize that you're having a subliminal flashback and realize that you're not dying and just chill out for a while and be okay about it. Maybe do some breathing exercises, maybe take a walk, maybe do some push-ups. But there's a hang-up about solving this problem, and this is what the hang-up is, because when the flashback occurs, rather than thinking, gee, I'm having a flashback, you think, I'm dying. And I may say, no, you have to think, I'm having a flashback, otherwise you're going to have a panic attack. Your answer to that is, no, I'm dying. My answer to that is, no, you're having a flashback. Your answer to that is, no, I'm dying, etc., etc., etc. It's very difficult to move into the idea that this is a flashback, not dying, for a couple of reasons. First of all, if I'm wrong, you're dead the next minute because you didn't listen to your own thought and go to the emergency room. So why would you take that chance? That's the first and most obvious thought. But after 100 straight panic attacks, none of which killed you, I'm still saying it's a flashback, and you're still saying, no, I'm dying, after 100 times. So what's going on? What's going on is you don't want to think about this as a flashback, because if you do, then the next question is, well, what am I having a flashback to? You can't have a flashback to nothing. You're having a flashback to something that happened that was very stressful, very horrifying, and awful, and you don't want to think about that. So if I say, what are you having a flashback to? The next question is, I don't want to go there. I would rather go to, I think I'm dying, rather than think about the trauma where father abused me, uncle sexually abused me, mother abandoned me, etc. Really bad things. I don't want to go there because it's just too awful to be thinking about that. So rather than look at, I'm having a subliminal flashback, and then the next question is, what is this a flashback to? I don't want to ask that question because I don't want to go there. So I'm going to jump out of that conversation and stay in, I'm dying. Take me to the emergency room because I'm dying. I would rather be there than think about the awful situation. So the thing now that we're focused on is resistance. You're resistant to the idea of the flashback because it's too painful to go to the question that comes up if you accept the flashback idea, which is, what am I flashing back to? You don't want to go there, so you're stuck with the panic attack, basically.